All right, so in continuing talking about thoracic mobility and stability, I'm going to bring up diaphragmatic breathing, and you've probably heard a little bit about it, if not a lot about it, out in the fitness world these days. So it seems to be all the craze, but that doesn't mean it's any less important than any of the other stuff that we've been talking about. So really, what am I talking about with a diaphragmatic breath? Well, most people breathe wrong, which is funny because, air goes in, air goes out, you're alive. What's the problem? Well, the problem is that we tend to breathe up into our chest and our shoulders and our neck, which relies on muscles that should be movers and stabilized for posture and shoulder motion and neck motion, and not breathing muscles, but yet we use them as if they're breathing muscles. So most people breathe something like this. So even when I say take a deep breath, most people start up here in their chest, and you can watch their neck, shoulders, and chest elevate. Okay? Whereas in a perfect world, we'd be breathing more into our belly. The diaphragm goes kind of like this across the bottom of our rib cage, and when it contracts to pull air into the lungs, it should pull down, not up and out. So a better breath would look something like now. Not everybody can do that on control. It takes a little bit of practice. So I'm going to show you a couple of drills to learn how to really engage the abdominal wall muscles to help stabilize as the diaphragm does its job. Okay, it's going to feel a little strange in the beginning, but that's okay. To start with, you're going to take your fingers and you're going to place them on the abdomen right above your pelvis. Okay? Then you're going to take your thumb and you're going to stick it on your low back right above your pelvis in the back. Okay? Now when you try to do a belly breath, I want you to push in a little bit, give a little bit of pressure with those fingers so you can feel it in your abdomen. So open up, and you should feel equal pressure against your fingers all the way around. Now, it's not perfect, and it probably won't be. You might even feel one area is really firm, another area is kind of squishy. Your goal is to try and push out into all of those areas equally. So even in this position, just keep your hands there and push out as you breathe. And so right now, my left thumb has a little bit of a squishy spot. So I'm really going to focus on this next breath to try and push that spot out. Okay? It takes a lot of practice. That's okay. So another thing that we can do is change the position. So if this is challenging for you, we're going to do the same thing, but we're going to call a 90-90 position. So you're going to lie on your back with your knees bent to 90 degrees and your hips bent to 90 degrees, just like this. Okay? You're going to put your hands in exactly the same spots, and then the shoulder blades, your sacrum, and the back of your head should all be on the ground. So here we are, and now I'm going to do the same thing. I'm going to breathe in, and I'm going to try and feel tension with my fingers, okay? Once you notice that you can establish some of that tension in your abdomen, try and hold it for 3 or 5 seconds. Now you might notice that I'm kind of moving my hands around and pushing and poking and squeezing. You don't have to do that. I am just doing that to illustrate that I am forcing my fingers into my abdomen, making sure that I can feel some resistance there. It'd be a good idea to try and do up to maybe 3 minutes of this. That might be a very ambitious goal. You might just do 10, 20, 30 reps, breaths, just to see if you can establish that tension, that resistance first. Once you get the hang of it and you're able to actually start committing that resistance, that's fine. Start doing your normal breathing at a normal rate and then do it for time, okay? In a perfect world, you'd hold the position for 3 to 5 minutes while breathing and being able to maintain that tension the whole time.